Okay, so we're right on 6:30. We might get going, but acknowledging that I think we'll have others who join us as we go along, but conscious it's probably been a big day in clinic, so we don't want to hold you too much longer. So welcome everybody to our session tonight. My name is Bianca. I'm the Director of Primary Healthcare Improvement here at the Primary Health Network. I do just want to introduce Marie Hunt, who is also here from the PHN, and many of you will have been speaking to Marie. And also we've got Jenny Jones from Cancer Council Victoria and Wendy Pakes from VCS, and they'll introduce themselves a little bit later on. So before we do start, I do want to acknowledge the traditional owners of the lands on which we're all meeting today. For me here in Parkville, it's the Wurundjeri people of the Kulin Nation, and pay respects to elders past, present and emerging. So thank you very much for giving up your Wednesday evening. So you're all here because you've been involved. You're involved in our Maximising cancer screening outreach project. So we're really excited to have so many practices involved. You've also chosen to focus on the objective around increasing the number of HPV self-collection tests completed for eligible women. So that's what we'll be hearing about tonight. I just also want to acknowledge the practices in the room. So we've had to pull, had you come to some education pretty quickly. So there was a big education session that VCS, CCV, and also we had some hepatitis education that was delivered sort of on the 8th of April. And then we've obviously had you come along to tonight. So I do just want to appreciate it's an incredibly busy time in general practice, and fantastic that you're able to attend. And you'll be happy to know, as I'm sure the team delivering these sessions are, this is the last one. And so from here, we will be moving into that real practice level support, which Marie will be providing, as well as Phil, who's also from our team as well. So without further ado, I will continue to admit people as they come, but I will hand over to Jenny, who's going to kick off the formal presentation.
Thank you. Thanks, Bianca. Okay, can everyone see that?
It's just coming. I think it, like when we tested it before, it's just taking a little minute to come up there.
Well, while it's coming up, I'll just say hello and welcome you. Welcome to the Cancer Council Victoria Practice Level Support webinar. And as Bianca said, this is around your objective of increasing the number of HPV self-collected tests completed for eligible women. My name is Jenny Jones and I'm the Primary Care Engagement Coordinator at Cancer Council Victoria, but I'd also like to introduce Dr Wendy Pakes, who's the Liaison Physician at VCS Foundation. So thank you once again for joining us today. As Bianca mentioned, I would also like to acknowledge the traditional custodians of the land on which we are meeting from today and pay my respects to elders past and present and those emerging. I extend my respects to Aboriginal and Torres Strait Islanders who are present with us today. And I'd also like to note before we start, for the purpose of this presentation, when we talk about women, we're referring to anyone with the cervix. I'd also like to thank all our partners that have been involved in this project. Okay, so as Bianca said, this session builds on the clinical education that was delivered by VCS Foundation the other night. And this session provides more practical information to support you in achieving your learning outcomes and commence developing and implementing cancer screening activities to meet your set target. So the learning outcomes for tonight are to describe the enablers for creating a culturally safe and inclusive environment to support an increase in HPV self-collected tests in eligible women, and to implement routine recording of patients' Aboriginal or Torres Strait Islander and culturally and linguistically diverse status on cervical screening pathology request forms. We also have the outcome to describe effective strategies to increase HPV self-collection tests, once again in eligible women, and also to define the roles and responsibilities for your general practice team to achieve this screening goal. Also, if the last one is to identify where you can access evidence-based information, resources, and further training to support your practice to increase HPV self-collected tests in eligible women. Now, before we keep going, we are going to have a little quiz, which I'll get Bianca to pop up on the screen. So the quiz is going to be around, so if you could just let us know how many of you are actually currently offering HPV self-collected tests to eligible people in your practice. So I can see a few of the answers coming in now. Okay, so I'll just end the poll.
Oh, end it? Yep.
Yep, that's all right. I can do this and I'll share the results with you. So currently we have 43% already offering self-collection and 57% not. So that's a good gauge of where we're up to for this presentation. Okay. So as I mentioned, the first outcome, we're going to just talk briefly or quite thoroughly now about cultural safety and inclusiveness in your practice. And we're also going to be mentioning again about Aboriginal, Torres Strait Islander and culturally and linguistically diverse status on pathology forms. So before we get on with, we'd like to sort of think about what is culture. So culture is not just ethnicity or where you were born. It's about how we see ourselves and where we feel we belong. So it impacts all of our daily actions. So for some of these things, they're very obvious to outsiders. They could be things like how a person dresses or the way they speak. But for some, these are essentially hidden. And as healthcare providers, we will not know about them until we ask about them. These include things like attitude towards screening and even beliefs about whether actions we take as human beings have an influence on our health outcomes. So things that we absolutely take for granted as healthcare workers working in a Western medical system might not be taken for granted by some of our patients. Now, I know we covered cultural safety in the VCS sessions, but I want to talk to you about how we can create cultural safety within your own practice. So we know that regular screening and HPV vaccinations are the greatest protection against cervical cancer. However, more than 70% of cervical cancers occur in women or people with a cervix that have never been or who have lapsed in screening. And in Victoria, these underscreened groups include people like from lower socioeconomic status, with people from culturally and linguistically diverse backgrounds, Aboriginal and Torres Strait Islanders, people with disability, people who have experienced violence or abuse, older people, and also people aged between the ages of 25 and 30, people who identify as lesbian or bisexual or transgender men, and people from rural and regional communities. So studies have shown that 86% of never or underscreened women or people with a cervix who decline a speculum examination agreed to a HPV self-collection test if it was offered. So if your practice has a good understanding of the barriers and enablers around participating and can proactively engage patients around self-collection, this will help to increase the uptake in your practice. It will also support patients getting re-screened. So we will now look at a few of the barriers to screening. So one of the big ones is emotional and cultural barriers. So it could be around embarrassment and the awkward nature of the test. And in some countries, there is body shame issues and a stigma and a taboo around sexual topics. A fear of the diagnosis of cancer, or people believing they are not at risk of cervical cancer. So there's often this perception that HPV vaccinated people do not require screening, or that screening is not required for women who have had sex with women or for transgender men. You might hear comments like, oh, I've had the cervical screening vaccine, or I'm no longer sexually active, or I've only had the one partner. So there's often these sort of comments that come up that, you know, we need to think about. There may also be a reluctance to rescreen after a previously negative experience involved during the test. And for some patients, the negative experience might be because the health professional hasn't used sensitive communication or language, or explained the process beforehand, or where the speculum has been uncomfortable and hurt the patient. For others, it can be linked to an emotional trauma from past or present experience of sexual abuse, which is triggered by the invasive and intrusive nature of the test or the thought of having a test.
Random number, electricity.
There's also cultural beliefs and inequities such as religious beliefs, fatalistic attitudes to cancer, health literacy is a big one, and lack of a trust in the Western medicine or past experience of racism in a practice. And also mental health issues like anxiety and depression or low self-esteem can lead to a lack of will to want to participate in screening. Some patients, they may not have the knowledge, they might have no knowledge around cervical cancer, or who needs to be tested, or the purpose of cervical screening in prevention. And this can be due to maybe limited experience of screening programs or the knowledge of the role of screening. And when it comes to self-collection, many patients are not aware that it is an option, or they are unsure about the accuracy of self-collection compared to their GP or practice nurse doing the test. There's also social and physical issues that can be a barrier. So patients who attend local communities run health services may know the GP or may know the practice nurse and can be embarrassed or feel that there could be confidential concerns. For some people, screening is not a priority. Preventative healthcare is overlooked in responding to acute episodes of illness or other health and welfare issues. Patients may have difficulty accessing and navigating the Australian health system, because it can be at times quite difficult to navigate, as we know, or have a lack of trust in government and government bodies. And cost, of course, can be a very big barrier too. For example, a patient needing to pay for a cervical screening test rather than being bulk billed. And also some patients may not have access to childcare to attend the screening in the practice. There are also physical barriers or access for patients with disability or patients who have other issues such as female genital cutting, past experience of sexual assault, menopause, arthritis and obesity can make screening quite uncomfortable. So self-collection is very welcomed by patients with disability, but as you can imagine, there might be different levels of need, such as a doctor or nurse helping with the self-collection while the patient is lying on an adjustable bed, or also discussing if they are able to complete the pathways. So in requiring that some patients with disability may need to have a GA if they need to go for a colposcopy after a positive test. And Cancer Council Victoria have resources on screening patients with disabilities, and these are two of the ones we have here. Betty's Story is a very good resource, and both of these are on the Cancer Council Victoria Hub, Screening Hub. Now, as you know, there are barriers for the healthcare provider too. So one of the biggest ones I would imagine for you is time constraints and pressures to restrict consultation times. Other barriers could include maybe a lack of female GP or a practice nurse to deliver the cervical screening test, because as some patients may perceive this as not being a safe environment. You may know your patient personally, as I mentioned before, in the opposite way, and it could be awkward to maybe discuss cervical screening with them. And a lack of financial incentive to provide nurse-led cervical screening business models. There could be a lack of understanding regarding the self-collection pathways, including the eligibility criteria. And furthermore, studies have shown that sometimes there is a lack of understanding of the next step if the patient has a positive HPV self-collection result. And some GPs have an assumption about the inaccuracy of self-collect and that it isn't a reasonable alternative to a practitioner-collected screening for underscreened patients. As we've discussed, underscreened patients are likely to experience multiple barriers to cervical screening. That's why it's so important to have a culturally welcoming environment, a good understanding of your local community and strong partnerships with key community organisations. I might just stop there for a moment. I think somebody might have their computer audio on, and unfortunately we can hear someone talking. So maybe if everyone could just mute their computers. Thank you. Okay, so having mentioned some of the barriers, I now wanted to discuss some of the enablers, the good things that we can do, particularly in relation to increasing self-collection rates at your practice. So research from the University of Melbourne has shown that self-collection is an acceptable cervical screening option for underscreened women. And almost 90% of never screened patients who declined a speculum examination reported that they would agree to a HPV self-collection if it was offered. And of the patients who participated in self-collection and received an abnormal result, 91% of them undertook the recommended follow-up, which is amazing result, raising figures. The Melbourne University research also showed that for many patients, because they performed self-collection themselves, it gave them a sense of autonomy and control over the test. And that embarrassment and humiliation that we talked about earlier was overcome by the self-collection because there was no one else present or watching and no one else was touching the patient. So the biggest take-home message for your practice about how to increase self-collection rates is to provide underscreened patients with information, education and support regarding the HPV self-collection test and clearly explain the cervical screening pathways. And many patients don't know that it is an option, and GPs and nurses need to let them know and endorse invitations and support. So the other thing, because we've mentioned a few times that a barrier to patients participating can be around sexual trauma and past or present experience of it. So it's also a good idea maybe to consider a trauma-informed care approach for screening for underscreened patients. If possible, have a nurse cervical screening provider or female GP to either provide the cervical screening test or support the patient with the self-collection, and then follow through with the pathways. Ensure this service is promoted widely to the community and let patients know they can have a female GP or nurse if they prefer, if available. Furthermore, provide a nurse-led cervical screening business model can help implement successful strategies such as targeting weekend clinics and education sessions for different underscreened patients. Further information about the business case we'll talk about a bit later, but it's also in your electronic kit. So let patients know they can have a support patient with them if they're attending for their cervical screening appointment, or if it's a practice-based self-collection or attending a telephone consult for a home-based self-collection, they can have someone with them. You might consider undertaking some extra training around screening patients who have experienced sexual assault or violence as well. During a consult with patients is the perfect time to educate patients around the HPV and cervical screening. A couple of key points are stress the importance of regular screening as a preventative measure, and that HPV vaccinated people and women who have sex with women or transgender men still require screening. Clarify patients' misconceptions around not needing to have a cervical screening test and beliefs about cancer. So that might include that the HPV virus can lay dormant for years, and just because a person is no longer sexually active doesn't mean that they should not participate in screening. Make the screening experience as comfortable as possible to ensure rescreen, particularly for women with more sort of mobility problems, including arthritis or obesity. And you may have to clarify the misconception in certain culturally and linguistically diverse communities that married women or women who have unfaithful husbands will not be exposed to HPV and therefore do not need to do the cervical screening. We've heard from community this is something that needs to be reinforced. In general practice-based self-collection project conducted by Cancer Council, the practices who reported the greatest increase in self-collection attributed this to nurses starting the conversation with eligible patients and providing education. And this was also done during a longer consult. So by having that longer consult, bringing up the topic of self-collection, giving them some resources, and even if they have to come back for another time to undertake it. So have that proactive and opportunistic conversation at routine appointments and even just health checks about cervical screening options, and educate eligible patients about self-collection to maximise opportunistic screening. This is also a good time to mention the option of home-based self-collection for some patients. Another great idea that comes out of the project was the use of visual tools to assist in explaining self-collection. This includes pictures of the reproductive system, and this can also be preferable to written resources with low literacy, with people with low literacy or who have not sure about their anatomy. So research shows that some patients think they need to insert the speculum themselves, and these are the sort of things that we can clear up during that conversation. Cancer Council has educational flip charts, which are designed for Aboriginal and multicultural patients. They explain what HPV is, why screening is important, and how the cervical screening test is done. We also have them in a digital format, and it also helps to have a demo self-collection kit with you to show the patient and also to utilise the VCS resources explaining self-collection, and they're available in many different languages. All these resources, once again, we're referring to are in the electronic kit, and we'll talk about the flip charts in a bit more detail later. To help patients feel safe when attending your practice, these are really important things. Display different brochures and posters that target a range of different under-screened communities and cultures. Offer written information, as I've mentioned before, and resources in appropriate language. And Cancer Council has these resources on the Cancer Screening Hub, which we'll talk about later on in the presentation. So if you need to provide an interpreter service at an appointment, it's also helpful to book a double appointment because it often takes a bit longer when there's an interpreter present. Offering bulk billing screening appointments to reduce that cost barrier we talked about. And when sending reminder letters and SMS, have the cost up front so patients know what they're up for when they come along for their screening. Further, some families may not have access to the support, for example, as we mentioned before, of childminding. So offer flexible appointments for screening. Models such as weekend clinics, evening appointments, or alternatively offer self-collection at the practice or at home. These will really reduce that physical barrier, and for some patients that face ongoing barriers to coming into a practice to have a practice collected self-collection test. So introduce a range of effective internal processes to engage and train staff to support under-screened patients, and a whole of practice approach is vital, and we will discuss this a little bit later in the presentation. Now, I know that asking the question was covered quite thoroughly in the VCS clinical update presentation, but I just wanted to mention again the importance of remembering to ask patients their Aboriginal Torres Strait Islander status, their country of birth, and the language spoken at home, because we know that this improves identification. This improved identification will enable the delivery of culturally appropriate and targeted services for Aboriginal people. It will also help with improving data collection and contribute to that closing the health gap. People are often not comfortable about asking the questions, so it's important for practice staff to be clear as to why they are asking and be matter of fact, stating it is just part of general demographic data collection. And there was an excellent video that was shown during the VCS presentations, that I've included a link to that in the references at the back of this presentation that you can show your other members of your staff, your practice staff. So as you can see, VCS form has the appropriate boxes, which we have circled there. And I believe now that Sonic has these same boxes on their forms. But if you are using other private pathology forms, just write the information anywhere on the form, because once the pathology lab receives the information, they are legally required to report this information to the National Cancer Screening Registry. And your PHN can provide further support about setting up practice management software to automate this process. Okay, so now we're going to look at some effective strategies to help you increase the uptake of HPV self-collection in your practice. I would just like to also say that please note that we'll be just providing a very high-level overview of these strategies, and that the PHN will provide additional quality improvement support to undertake these activities that we're going to mention. Okay, so the first step is to conduct an audit, scanning the patient database, utilising practice software such as your PenCat or Polar to determine eligibility of your patients at your practice. So note that we're acknowledging that some practices don't have clinical audit kits or tools, yet they can still do a clinical search to find this information. And just a reminder to you about the eligibility criteria for HPV self-collection tests. Patients must be 30 years or over, must be more than 2 years overdue for their screening or have never been screened, and must have declined a practitioner-collected speculum examination, and must have no symptoms of cervical cancer. So PenCat has this great recipe which describes the process for using the clinical audit tool PenCat to identify underscreened or never screened patients, and explains basic steps and terminology on how you can add filters, like say for ages for 25 to 74. You can search on active patients only. You can pull reports across the 3 cancer screening programs, including cervical screening, and you can export a patient list. So again, please note that this is something the PHN can support you with as part of your, quality improvement. I'm just giving you a very quick overview today. So some of you may be aware the National Cancer Screening Registry healthcare portal, provider portal. So a few of you may already be using it. And I know that the online portal is something that many of you have been asking for quite a while. The portal is a combination, combined access point for the National Bowel Cancer Screening Program and the National Cervical Screening Program. And as part of this session, we'll only refer to the function of the portal for cervical screening, but please do take a look at what's also available for bowel screening at a time that's convenient for you. So the register maintains the national database of cervical screening records and sends out invitations to people when they're eligible to commence screening, which is when they've turned 25, and reminds people when they are due or overdue for cervical screening. So you'll be able to do a check and check the screening histories of your eligible patients for self-collection via the portal. And you'll also be able to see when the patient last had their cervical screening test and if they meet the criteria for self-collection. Now, just going to show a brief video. There we go.
The National Cancer Screening Register has introduced an online healthcare provider portal, providing a new way to access the register's information and services. The Healthcare Provider Portal allows healthcare providers and practice staff to more easily access patients' bowel and cervical screening data, ensure their screening remains up to date, and to submit program forms to support improved patient cancer screening outcomes. The portal can be accessed through the National Cancer Screening Register and PRODA websites. To securely access the portal, you will need a PRODA account. PRODA, or Provider Digital Access, is an online identity verification and authentication system used to enable secure access to government online services. The Healthcare Provider Portal enables you to access your patient's bowel and cervical screening information online, fill in and submit forms online, removing the need to print, scan and fax to the register, manage your patient's participation in the screening programs, and order a free replacement bowel screening test kit directly to your patient's address. The National Cancer Screening Register's Healthcare Provider Portal supports better patient care by allowing you to access your patient's bowel and cervical program-related data at any time. For more information on the register or the portal, visit ncsr.gov.au.
Okay, so what we've just seen, the new healthcare portal, provider portal, is going to be really useful if you're not already using it. And once you've learned how to use it and access it, it stands to save you a lot of time. So in the past, you might have had to need to call the cervical screening registry to check if you're on your patient's results, or to see when your patient was last screened. And we know this often involved sitting on the phone waiting for quite long periods of time and was not very effective use of your time. So now with the new portal, you'll be able to log on, check your patient's information and determine eligibility. So this is a picture of the dashboard where you'll be able to, this is where you can submit the forms I were talking about electronically, manage your patient's participation, and also view when your patient's invitation and reminders letters went out. And to access the portal, as mentioned in the video, the healthcare portal will be required to yourselves through the creation of a PROTA account, or to be a delegate of a provider with a portal account. Healthcare professionals without a Medicare provider number will need to apply for a PROTA account and then request to be a delegate. So that could be like the head, one of the GPs can make the practice nurse a delegate. But if you're a nurse cervical screener, you will already have your own Medicare number or provider portal. Access via the software used by your clinic. So as per the National Cancer Screening website, as of late February, they were saying that best practice integration has been available since January, and that medical director integration is listed as coming soon. So I'm sure when that comes, it'll be even more efficient for you to use. These are just and you'll get these slides afterwards, but these are some of the contact numbers if you need, and I've also put the links to the videos in the resources below. So now you've used your clinical software audit tool and you've identified your underscreened or never screened patients. Then you've checked the screening histories on the National Cancer Screening Registry portal to ensure that they meet the self-collection eligibility criteria. So you are now ready to send your GP endorsed letters and SMSs, recalls and reminders to your list of patients. And research has demonstrated that these are effective strategies to increase participation rates in the program. And further follow-up phone calls can also provide that initial encouragement to patients. So in your letters or your SMSs, you ensure that you have the cost up front. Remember, we talked before about that being a barrier cost. Maybe you might insert videos or resources that are translated or provide them in plain English for patients from culturally, linguistically backgrounds. And also mention if you have available a female GP or practice nurse, and mention that you'll be able to have an interpreter if needed available at the session. Now, this is another fabulous tool. GoShare is a platform that your PH is currently using and will give you a license to use for this project. It's a really powerful tool which I would highly encourage you to use. So you can bundle up resources like videos, patients' lived experience stories, fact sheets and other useful resources about cervical screening and self-collection that can be used in SMSs and letters. So you can also include information for different cultural groups. And it's a fabulous little resource that you can put all these little bundles together and then send them out to your patients. And the PHN, once again, will help you with these. So to encourage opportunistic screening, it's a good idea to add a little note or flag identifying each patient's cervical screening status to their electronic records to prompt you to discuss cervical screening when the patient next attends the practice. So then you can have that conversation with your patients at routine appointments and health checks about cervical screening. And it's a good way to just include that in your everyday sort of appointments so that you're constantly reminding them when they're due. It's also a good time to provide education about self-collection. And if you're doing a telehealth consult, this can also be a good opportunity to mention the option of home self-collection for eligible patients, of course. Other evidence-based strategy is to undertake a quality improvement audit activity. So one such audit activity that has been developed specifically for self-collection is the VCS self-collection audit. And I'm now going to ask Dr. Wendy Pakes from VCS to run through over the next couple of slides.
Thank you, Jenny. So yeah, VCS as the first lab in Australia to be able to offer HPV self-collection and offering it across Australia is very keen to enable practitioners to understand it and be able to offer it to their patients as a way of significantly reducing the burden of cervical cancer, which is largely in underscreened women. So the audit is designed to help you practice all of things we've been discussing here. So understanding the regulatory requirements at present, which are fairly strict about the eligibility for HPV self-collection. And just a reminder, at present, because of these regulatory requirements, there is no option for private self-funded HPV self-collection. So this audit will help you understand those eligibility requirements and who you can actually offer it to. And that includes considering, does the woman have symptoms that may suggest the presence of cervical cancer? So they need a diagnostic pathway. It's not screening as HPV self-collection. Now, also it's really to try and get you to understand, with the assistance of PHNs, how to use these data extraction tools so you can upskill in your practice and get used to making sure you're documenting cervical screening results in the tab in the history so it can be adequately extracted with the data extraction tools. And so hopefully that would help you get much better with using these sorts of tools, and also understanding the use of the portal in checking your patient's screening history. I personally have been using it for the last few months in my own general practice, and I can't recommend it highly enough. And particularly in these patients, we don't want to offer them a screening test that they may not be eligible for because they've, for whatever reason. So being able to access their previous screening history, recognise when they're underscreened, and offer the HPV self-collection for pathway. So next slide, please. So the audit steps are initially identify underscreened patients by the reasons we've been describing. Then you offer them a speculum or clinician collected sample, but if they decline for any reason, it doesn't have to be any reason at all, if their eligibility requirements are met, then you can offer them HPV self-collection and apply the pathway, and you're given lots of data and sort of information to explain it to patients, and then you collect the outcomes, look at what the data is, how well your uptake is, how can you improve in the practice, and redo it. And so at the end of this, you'll get the 40 CPD accredited points, which we all need these days. I think next slide. And we provide lots of resources to help you just utilise the HPV self-collection screening pathway and feel comfortable about offering it to your patients. So all of these other sort of resources and maybe invitation letters, instructions, as well as the information about audit tools. So thank you. Hopefully you'll be interested.
Thank you, Wendy. Very interesting. Okay, the next learning objective was around whole of practice approach to screening. So we're going to look at some effective strategies that can use in your whole practice to get everyone on board. Okay, so as we've talked about the effective strategies to increase self-collection, we are now going to talk about, as I mentioned, best implementation across your whole practice. So an engaged and effective practice or team are the foundation to meeting your targets. And if you want to change the cancer screening outcomes in your practice, you need to have a whole of practice approach. It's that change management sort of feel about it. So it includes the GPs, the practice manager, the practice nurse, and other non-medical staff. So think about how your practice is currently operating. The whole of practice approach should address the patient, the practice, and systematic barriers to cervical screening and self-collection for patients. So consider nominating a dedicated person or a champion, if you like, who is responsible for the change, and ensure that everyone has a clear understanding of their roles and responsibilities. So I would suggest that firstly you develop a clear plan with all practice staff have that input into it. And it is important to have policies and procedures in place for cancer screening and have regular meetings to discuss key actions and track progress as part of the ongoing quality improvement process. This is the Cancer Screening Quality Improvement Toolkit, which has been developed in conjunction with 3 PHNs, including the Northwest. And it has lots of great information to help you develop a clear plan and to promote ideas throughout your practice. So it has quality improvement planning, has a model to follow for how to set that up. It has guides to measuring your progress using data and tips on using a team approach to achieve the best outcomes and several other fabulous ideas. So it's well worth, and once again, that's in the resources at the end of the presentation. Now, questions that you can think about to sort of get your mind around this is things like, do all members of my team know their roles and responsibilities about meeting the target for this project? Does your whole team know about this project? Do you have clinical staff have the knowledge and skills they need to offer cervical screening to patients with a history of sexual abuse or patients with a disability, patients who's not comfortable with screening, if it's impacted by cultural sensitivity or language barriers, and do all staff understand the self-collection pathways for eligible patients? Do you display cancer screening material or brochures around your practice or posters, including information on self-collection? And are there any visual clues to demonstrate your practice as a culturally safe place? So does your team understand the functions available to the new National Cancer Screening Registry provider portal? And are they registered to use this, and have they had training for it? So are all your staff trained about how to ask the question around Aboriginal and Torres Strait Islander peoples and culturally and linguistically diverse identification status? And is this recorded across practice forms, including the cervical screening pathology forms? So next we're just going to do another little quiz. And I'm going to ask Bianca to put the first question up.
Yep, just 1 second.
Right. So just while you're doing that, I'll just say that when we're doing this, we understand that all practices are different, and some may not have a practice manager, some may not have a practice nurse. So just answer these questions as per how your practice works. So the first question is, based on your role in the practice, how would you create a culturally safe and inclusive practice? How are we going? We've got some good answers coming in now. Okay, I'm in the poll now. a little mouse here, and share results. Okay, so got a lot of people saying as above. So yeah, so just as we've mentioned before, displaying brochures and flyers and posters is really important, because patients sitting in a waiting room, they might pick up a brochure on self-collect, and that might just prompt them to ask the practice nurse or the GP during their consult. And then, as we know, via education, you need to provide patients with instructions once you've talked to them about self-collect, and give them something to take home, because people often like to have a hard copy of something to read about. We talked about understanding your community, forming relationships with people in your community, and that's ways of getting the message out about self-collect being offered in your practice. Remember, if you're using private pathology forms, to ensure you record Aboriginal and Torres Strait Islander status that's been marked as important, and have interpreters at appointments if needed. Other things might be that you might also consider displaying an Aboriginal flag or artwork in your practice. And for many Aboriginal people, that's a sign that your practice is culturally safe for them. You might also consider undertaking extra training around cervical screening for patients who have had sexual assault or been sexually abused. So there are other ways of making your practice culturally safe and welcoming. Okay. So Bianca, if you could put up the next quiz question, please. So the next one's around, based on your role in the practice, how would you use the National Cancer Screening Registry healthcare provider portal? Remembering, I understand that there's different, people have different roles in the practice. Okay, results coming in now. Okay. I've got a few there, so I might end the poll now and share the results. So I think most people are saying all of the above, which included things like upskilling knowledge on the new cancer, the National Cancer Screening Registry portal, ensuring you have a delegate of Medicare provider number if you're not a nurse cervical screening provider or a GP, using it to check patients' eligibility and screening history, and ensuring staff are all ready. So when you're ready to go, everyone's ready and got access to the portal. Okay, we'll do the last quiz. Thanks, Bianca. So the next one is, based on your role in the practice, how would you include opportunistic screening to increase the number of HPV self-collected tests in eligible women? So the results are coming in now. Okay, well, I'll end the poll now and I'll share the results. Okay, so it looks like most people are saying that they'll promote the screening program within the practice via SMS and emails to promote it widely to the community, respond to recalls and reminders. So that's a good way that you can just, if your patient's coming in for a common cold and there's a little reminder on their history saying they're due for they're overdue for a screen, you might just then bring up the topic or the conversation around self-collection with them. So also we've got supporting patients by addressing potential barriers to screening. This could be addressing fears about how the embarrassment of it, or fears about the diagnosis of cancer, and maybe just even offering HPV self-collection to eligible women is a good way of overcoming some of those fears. So that's the end of the little quiz. Oops, I'll just go back. Sorry. There you go. So just over the next couple of slides, we've got, we have some more detailed slides here, but we won't go into them in any detail, but these are all, there's just some more options and ideas that you might think about just to engage the whole staff in your practice and get everyone on board. And they'll be in the presentation slides that will be given to you afterwards. Okay, so lastly, we're going to our last learning outcome is around looking at some further resources and training that you might undertake to help you with your objective. So the Cancer Screening Resource Kit, which is another excellent resource, it's full of further information and resources and training to support your practice. And this is also in the references at the bottom of the presentation. It's another awesome resource. Now, the Western Vic PHN, in partnership with Cancer Council Victoria, developed this cervical screening in primary health guide. So it's on how to successfully incorporate cervical screening in your primary care setting. The guide provides a comprehensive insight into focusing on quality improvement and business sustainability for general practice clinics, health centres, community health centres, women's health centres, and sexual health services and Aboriginal health services. So it's for a range of primary care services. And what's included in this resource is there's how to include cervical screening as part of your practice, the role of the nurse in cervical screening as a cervical screening provider, and quality improvement for cervical screening. And it also has an excellent section on nurse-led clinics and how they work in the primary care setting. So if you're interested in that, thinking about setting up a nurse-led clinic, it's very detailed how you would go about that. And that's also, as I mentioned, in the resources at the end. Now, the optimal cancer care pathways are documents and quick reference guides that describe optimal cancer care for various cancer diagnoses. They're a great way for health professionals that don't work full-time in cancer care to check details of pathways and recommendations for patients with a variety of different cancer diagnoses. They can be located here where the arrow is on the Cancer Council Victoria webpage, and each optimal care pathway has information about prevention, detection, investigation, treatment, and more. Now, the full optimal care pathways are about 60 to 80 pages long and reasonably technical. But there are these 2-page quick reference guides for each of the optimal care pathways, which summarise the key points and are really handy. You can also print them off and give them to your patients when you're talking about different treatments they might be asking you about. And there is also an Aboriginal optimal care pathway and an optimal care pathway consumer guide. So very handy, another very handy resource. I think everyone is probably well aware of the health pathways, and it's a free online resource that GPs can use to get best practice information to help access and refer patients in their area. The pathways are designed to be used during consultation, for example, to seek information on cervical screening, including self-collection, and find a local referral option for follow-up of any abnormal screening results or cancer diagnosis. Access Healthcare Pathways Melbourne is a dynamic website with new pathways constantly being developed and existing pathways regularly reviewed. So it's very up-to-date information. It also applies the latest clinical guidelines and statewide referral criteria for positive HPV screens, including follow-up for colposcopy. And if you can link to, it can also be link you to other valuable websites and tools related to specific cancer screening. So another very important tool. Okay, so the Cancer Council Victoria, I've mentioned this a few times throughout the presentation, manages the Cancer Screening Hub, which has an extensive range of supportive tools, templates, resources in many different languages. There's lots of translated information. It has presentations you can use and case studies to help you implement strategy to improve screening rates and deliver an inclusively, culturally safe service. So also, and I think I mentioned this very early on about the flip charts, some of the resources we have for cervical screening include these two fabulous flip charts that can be used to educate your patients. So the two flip charts, there's one from culturally and linguistic backgrounds, and it's in very plain English, and we have an animated electronic version of it as well. Excuse me, the other one is for Aboriginal patients, and it's called Women's Business. And we have PDF copies and animated video versions on the hub. And if you would like a hard copy, because they're quite big and they're a hard copy that you can turn over the page while you're educating the patient, feel free to contact me. We'll give you my contact details later, and we can send you out a hard copy. But the PDF copies and the digital ones that you can show patients, or even send them in your bundle when you're sending out SMSs or letters, are in the on the hub. And just lastly, there are other brochures on the cervical screening for patients with the female genital cutting, and they're available in 7 different languages, and for patients who have experienced sexual assault. And this was co-designed with CASA Forum. So these are just the resources or the references throughout the presentation, and there's some references and resources from the hub. And we also have some links to further training, particularly the Queensland Health Cancer Screening Education interactive videos. They're really fabulous resources. They have some training there, some CPD training links there as well that you can use. Lastly, I'd like to just acknowledge all our partners for all the work that has been involved in these presentations, and thank everyone. And I think we're pretty much 3 minutes over, so I'm not sure if there's any questions or how we're going.
We do have I know we are over, but if anyone does have a burning question, please feel free to ask that now. Of either Jenny or Wendy from VCS while we've got them. But potentially we're at the end of a very long day. No burning questions. There's one in the chat. So from Natalie, any plans to run the CASA training that was cancelled last year?
Excellent question, and very spot on, because I've just been speaking with the the CASA team, and we will be, I'm presuming that person was a nurse cervical screening provider, because it was cancelled last year, back in March when COVID hit. Yes, we will be organising some in this first part of this year, and we will be sending that information out through our nurse cervical screening provider speculum magazine. Fantastic. And letting the PHN, we can let you know as well to publicise it.
Great, excellent. So if there's no further questions, please join me very much in thanking Jenny from Cancer Council Victoria and Wendy from VCS. Thank you for a really informative session. There's just see some thanks that are coming through there, and a virtual clap. We're getting very good at the virtual sort of world now. So look, in terms of next steps for this project, so as I said at the start, the next steps really is the focus on the in-practice support that Marie will be providing to practices, but also with our new staff member, Phil, who starts next week. So yes, we're very much looking forward to now working with you on the sort of the next phase of the project. But as I said at the start, really appreciative that you put your hand up to be part of the Maximising Cancer Screening Project, and great that you're looking at focusing on self-collect, and really looking forward to working with you all on improving cancer screening rates in our region. And just again want to acknowledge that it's great you've stuck your hand up and have participated in these education sessions when things really are very busy out there in general practice at the moment. So we will let you get on with your night, but thank you all very much for joining us.
Thank you, everybody. Have a good evening.
See you.
Thank you.